You are now entering the Queen's Quarters. We are powerful, strong, and rulers in our own right. There's a queen in you. There's a queen in me. Every woman is a queen.
Hello, everyone. Welcome to our Queen Quarter podcast. We are women of all ages sharing our views and opinions on different topics. The Queens would like to thank you for tuning in and spending time with us. Just before we start our show, we would like to do our roll call. And right after, we have Tea Time with T. I'm Ty, and I represent the 50s Club.
Hello, my name is Queen Emma, and I represent the 60s Club.
Hi, I'm Queen T, representing the 50s Club.
Hey everyone, I'm Queenz, representing the 40s Club.
What's up, everybody? I'm Queen Lady B, representing the season 30s.
Hey y'all, I'm Queen I, representing the early 30s.
So we're gonna have tea time with Queen T. So today I'm gonna introduce to you hibiscus tea. It is a herbal tea packed with antioxidants. It may help lower your blood pressure. Also, it helps to lower the blood fat levels, which is a risk factor for heart disease. So get you some hibiscus tea and let's see what's going on in Queen's Quarters today.
Okay. Thank you, T, for that. We have a surprise today. One of our queens, we're celebrating her birthday.
Oh my God.
Happy birthday
In the building.
Oh my God.
Lady B.
Make me cry.
Lady B.
Oh my
And we
God.
gonna surprise her with a gift.
We would like for you to open up your present.
Lady B, you can be
Queen Lady B, you can probably do it.
Happy birthday to ya.
Oh, come
birthday to ya. Happy birthday.
Oh my God.
All right.
I love y'all so much. Y'all get on my nerves right now.
That's from Queen Quarters. It's from all of us.
Quarters.
Yes. So you gotta show all of our kings and queens
God.
what you got.
Okay, all right, okay. This box is so beautiful. Look at this box.
That is
Oh my
beautiful.
God.
Thank you, Queen T. Queen T.
Y'all got me shedding real tears here. I'm gonna get y'all.
Queen T did that.
Yes, she did
You
that.
know, while she's opening up her
y'all.
gift, Lady B is so considerate. Everybody love you. You know, you're the one that keep us grounded. You know, you're so considerate. You're so giving. You're such a sweetheart.
Oh my God.
And we hope you
this
like
is so
everything you got.
Look at
You
that.
gotta turn it. You got it upside down.
Oh wait, okay. Oh my God, this is so beautiful. Oh my God, I love it. This is so beautiful, guys.
It's a real rose
It's
inside of a
Glass.
glass. Isn't that
Yes.
beautiful?
It's so beautiful.
And
I love it.
purple royalty. Yes.
Wait a minute. You said
Our
tea
colors.
is in here too. Wait a minute. Oh, cut it out, guys, with the extra gas. Oh my God. Oh my God. Y'all are too much. You said tea is in here too? Tea is in here too? You said the purple tea is in here?
No. I was saying that
Oh.
purple's for royalty. I was saying
Oh
that
yes, I thought you said
royalty.
tea. See, y'all got me so emotional. I'm mixing up the word. Oh my God, y'all are too much. Oh my God.
Our
Oh
viewers.
my God. And this is a for real surprise. You know how people be thinking stuff is staged. No, I'm crying real
Yo, yeah.
Say to our viewers, she had no idea.
She had no
Had
idea.
that box waiting for her.
God, I had no idea.
We'd
My
like to
mother-
thank her family for joining in, helping us to pull
Yes.
this off.
I have to shout out Queen Glenda.
Oh my
Little King was in on it. Grandma Queen was in on it. Girl, we had to pull in everybody to make it happen. So
I gotta get myself together. Thank you all so much. I love you girls. Oh my God.
You too.
Awesome. That's awesome.
I love
We
you.
love you, Lady
So,
B.
so now we're
love
done
y'all
with
too.
that. We're going to
Oh my God.
continue with our show.
I believe there's some more things in that box, but Lady B, we just want to say that I just want to say that I love you and I thank you for being the person that you are. You are transparent, you are giving, and most importantly, you are a godly woman. So you do everything with perfection and grace, but at the same time, you real. And I just love it. So I just want to thank you and thank you for being a part of this. And we just want to tell you that we love you. We appreciate you.
Yes. And I can say on top of that, I can always rely on B for a neutral answer. Whenever I have an issue, I call her and he tells me, well, Thais, I'm just going with it. I'm just happy to be right there. And I appreciate that. I appreciate you for who you are. And I thank God for you.
Yeah. And
Ty,
Queen, you my sister girl from day one, girl. And I really thank God just for, I remember when we was on the line with all the ministers at church and it was happening. And God just turned on the light, like it's time to connect and collab with her. So bringing you in on this endeavor was actually such a wonderful God-given idea and gift. Absolutely. So we definitely thank you for saying yes and being a part of this platform.
Yes.
Thank you, Tans. I love you guys. I love you guys so much. You're so right. Like that was so God orchestrated, or he put that together. He put that thing together. I didn't understand that moment or with the ministers too, but it actually brought the moment of you guys asking me to be a part of such an amazing movement, and I'm so forever grateful for the opportunity. I love you girls, all of you so much. Thank you.
Well,
we love you too.
Lady B, I love you dearly. Continue to be the beautiful jewel that you are, the beautiful soul that you are, your beautiful inside and out. Continue to be the woman of God that you are. I pray this is one of your best years yet. And last year was kind of rough for you, but you made it. You beat COVID. So I'm so excited for you in this year and all your new endeavors. You got some things coming up, so we're very excited. I've known you for a long time, B. Right. So keep being you, and I'm excited for your future.
That's so wonderful. And although I haven't known you for as long as the rest of the ladies have, what I've gotten to learn about you is you are truly a God-fearing woman. You sweet all the way inside and out. What you see is what you get. And I love and respect that about you. I always say, like, you can depend on Lady B no matter what. And I want you to have a happy year, a happy birthday. I want you to continue to go on, and we wanted to make sure that you were well surprised. We wanted to make sure you were well surprised. I mean, I can't wait to get my mother. She's just gonna march her little self in here and sit the box. I'm looking at the box like, what? I mean, they did a great job at keeping. I knew something was going on. I was like, wait, what's happening? Because she was moving different and everything. I'm like, okay, my son just disappeared for a second. Yeah. Oh my God. And yes, I have the other gifts, and I'm gonna get whoever trying to add to my hips because I see this Cheesecake Factory. I'm gonna enjoy it this day, and I ain't gonna worry about counting no calories. No, but
enjoy yourself.
Thank you, ladies, so much. And lastly, I know we want to move forward with the show, but I'm so used to being on the giving end that it's so hard and so emotional for me to receive moments like this because I just get joy in like putting smiles on other people's faces. So I thank you, ladies, from the bottom of my heart for thinking of me. This means the world to me. And my beautiful is going to my new place on my on top of my fireplace. So
we got a fireplace.
Yes, girl. I can't wait to have you ladies over when everything, clears up and stuff. But yes, thank you, ladies, so much. I love you all dearly. And I mean that. And you girls know that by now.
And one thing about B is she's a female boss, a lady boss, whatever you want to call it. And I'm so excited. Business, You're truly a person I consider one of my sisters. So I really appreciate you. Just continue to be you.
Yes.
Thank you, ladies.
Yes.
Thank you so much. Wow.
Thank you, ladies. Thank you, queens. And thank you to our audience for giving us the time to celebrate our queen on her birthday. Okay, so now we can dive right into our topic for the day. We, as everyone, well, most people don't know, but we just not celebrated, but we just had Black Maternal Health Week last week. We celebrated, well, not celebrate again, but we go through it every year around this time, April 11th through the 17th. I don't know if everyone do know, but United States, we rank 55 in the world for maternal death. As New Jersey, we also rank 47th in the highest Black maternal death as well. Not only that, Black women are 7 times more likely than white women to die during birth complications. So this comes from centuries of institutional racism, dealing with poor healthcare issues, which we would like to talk to our audience about that today and have our women, our queens, discuss the different topics that's related to complications of giving birth and issues on that matter. Let's start with Queen T. Queen T, do you have anything to add on this topic?
Well, as you was talking about health, I was just thinking about the fact that, I hear a lot of people say, well, why do you guys have poor health care? Is it because you are afraid to go to the doctor? Is it finances? What's the situation? And I just feel as though we're not afraid. We don't have fear of going to the doctor. I think part of it is finding a doctor that understand your makeup as a Black woman. We know women overall, we're all differently. We're made differently. So it's good when you can find a doctor that understands your makeup. So you are expecting that you're going to get you're going to have a good doctor that's going to help you take care of yourself and not just give you medicine because they're guessing this is wrong or that is wrong. Like somebody who's really going to dig down deep into your history, into your eating habits, because nutrition has a lot to do with our health. It's the things that we're eating, and I think that's another topic in terms of finding healthy things to eat. Finding things that's good for our body, doing the research, and I think it's not just always finances. I just think having someone that really cares about us, someone who's really going to give us truthful information and understand our makeup as women and women of color.
So do you think that that's one of the reasons why Black women are 7 times likely to have an issue with conceiving? And dealing with and even dying during childbirth?
Well, I really can't. I really don't know, because I've heard so many different stories. There's a lot of women who say they've been pregnant and they went so many months they didn't know. It could be an age situation. Maybe the person is young and they're afraid to tell their parents, afraid to go to the doctor, afraid of knowing. So it could be a various situations that could be a cause. So I really can't say it's just one thing.
Anyone else have
Well, I know when you talk about maternal health, so because a few people might say, what is maternal health? So maternal health is like the health of a woman during pregnancy, childbirth, and the postnatal period. And they do factor in the fact of exposure to child care, health care in itself. A lot of in our community, um, it is a lot financial sometimes because a lot of people aren't exposed to all of the doctors and specialists that they would need to go to, and maybe their insurance doesn't cover that or things like that, kind of definitely relates to women having issues. And I mean, some of the issues literally are like excessive blood loss, infection, high blood pressure, obstructed labor, and anemia, heart disease. So a lot of people go through a lot of this stuff, and they just not getting the proper treatment during childbirth. I mean, during that time of pregnancy, not taking your prenatal vitamins. Like them let me tell you something. I love prenatal vitamins. I mean, I think it's something you should literally take when you're not pregnant, because it gives you so many wonderful vitamins. And I mean, I feel like my hair was luxurious. I was glowing. I was like this. I was loving the prenatal vitamins, but a lot of
But
people,
why they gotta be so big? They like
huge. They are huge. But I'm telling you, the benefits of them things. Like I was taking them even after. I gave birth. I was still taking my prenatal vitamins, and like Tracy, like Queen T said too, a lot of teenage pregnancies, like they hiding it. And not even letting the parents know they pregnant until, or whoever's the over them or watching them know that they're pregnant until what? Like they're in the second trimester at this point.
Yeah, that's true.
And then it's so much, that first trimester is so critical.
So important. Yeah.
Right. Like
because that's the development. That's when the baby develops.
Right. It's the development stage. So, and it sets the foundation for second trimester, third trimester. So I mean, it isn't surprising that our culture is literally higher in number than other cultures when you look at society and when you look at our community and what we are exposed to. And I think the awareness factor is growing now a lot because we do have access to healthcare, and the healthcare laws and things have changed a bit. So a lot of things that we weren't able to get years prior, we are able to get now. And even if you don't have insurance, there's so many programs and things out there to help. So, I mean, I think it's increasing, but I mean, we still kind of got to watch it. And like you said, too, a lot of us don't like going to the doctor. And that's something that definitely needs to change as a community too.
Yeah. If I can jump in at this point, I think what's also, along with everything that has been said, I think what's also very important is for us to empower our young women, empower our young girls as they begin childbearing ages. We do advise abstinence. The reality of it is we advise that you remain abstinent, but the truth is it's not always going to be that way. So what you have to do is educate and empower these young girls to let them know that their body is a temple, and you don't have to give it away. But if you choose to give it away, you have to understand the cost to what that involves. You have to understand what sex actually is, because when a young man and a young lady are intimate like that, then you're giving him a part of you and he's giving you a part of him. And that's how a baby is created. I mean, the reality of it is more than just, sometimes younger people tend to think you're just doing it. No, it's more than doing it. You know what I'm saying? You are really putting his body in yours and your body in his. So what we have to do is empower them to let them know that, number one, it's a choice. It's a choice that you make. And if for some reason, no matter if you're married, single, young, middle age, whatever, when that happens, healthcare is so important. You let them know that it's important for them to get, like you said, healthcare at the very beginning, because that's when the baby is really growing and all the major organs and things are developing at that stage. And if there's something that you can prevent, it happens in those first 3 months. So don't wait until, you almost due at any minute, and somebody say, girl, you get mighty fat, and then 2 weeks later you dumping the baby. You know what I'm saying? So we have to make sure that we empower our young girls to let them know, and the guys too. We have to teach guys as well as girls, because it's not only even though the woman carries the baby, a pregnancy belongs to both parties. Should be as responsible as she is about taking care of her body and what needs to be nurtured, things of that nature. You know, like I said, we encourage you to wait till you get married and get settled or whatever. But the reality of it is, if you look at the statistics for teen pregnancy, all teens are not waiting. So we need to empower and let them educate people. That's so important. You know, that's so important to me. I just wanted to throw that in.
And
Nice.
B, yeah, I was about to call on you.
Thanks, Queen Ty. You know, this all puts me in a mindset of premature awareness, preemie awareness. And I say that because my son was a preemie. And my pregnancy, I thought, me and my son's father, we were young. We were young. I thought I was growing at the time, but I had my son when I was 21. And I had a normal pregnancy as far as I thought. You know, my insurance wasn't the best. At 21, I wasn't really working the best of jobs, you know. And you went to the women's clinic and you got the care that you thought you were getting. Right. And when I turning 7 months, my water broke in the middle of the night. And my son came 2 months early. My due date was June 20th and he came April 11th. And that was one of the scariest moments of my life. Nobody in my immediate family had ever had a premature baby. Wow. So in my head, the doctor that was delivering him, and he wasn't of our culture, I'll put it that way. He was like, oh, you'll be fine. You know, he was like, you know, you'll be fine. My son was premature too. He's a big kid now. But being a young mother, you don't understand that. Those words sound like blah, 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 blah. All you're thinking is my baby going to make it or not? And that's when my anxiety started taking over. Like, that's when I was introduced to anxiety. By the grace of God, I was able to overcome that. But it's so much, and I'm glad that we're touching on various things here that comes with becoming a mother, the risk, what it takes and what it plays on your health, because I battled anxiety for years after having my son. And I think it was the stress that I went through with my body couldn't rest. Right after I had him, he stayed in the hospital after me. So I'm running up to the NICU and they're like, you don't have to be here, Mom. And I'm looking at them like, are you crazy? I do have to be here. Like, you know, this is my first child. And I'm running up to the NICU, and his dad and I were running up there. And it's just like, my body just went into this shock. And this anxiety just took over my life. So in the beginning of his years, it was so much that went on with me. And again, by the grace of God and my relationship with him, even being that young, I wasn't where I am now spiritually, but I knew him enough to know that I have to hold on, or I'm going to lose everything. But I said all this to say, when I had my son in the labor and delivery room, they took the placenta and the doctor was like, oh, we're going to test it and tell you why your water broke. And I never got those answers. I never got those answers. I never got those answers. And I don't think that I may have pushed it enough. Again, I'm 21. All I'm worried about is my baby going to come home?
That's why you don't even really know.
Right. I remember her saying that after I had him, the placenta came out. She's like, oh, we're going to test it. We're going to see what caused your water to break. And I'm like, okay, or whatever, however she worded it. But I never got those answers. So it is a difference. You know, was it because my insurance wasn't the best? Was it because I wasn't considered a whatever type of client they consider when they pull out that extra care for you? You know, I know that's a touchy topic, so I won't dig too deep into that, but I was just sharing my story. So it is a difference, but by the grace of God, he made it. He turned 16, April 11th. So we good by the grace of God.
Yeah. You know,
that was scary. A young mother.
I have a good question. I have a question for you. So even after you had the baby, you still had to go to the doctor for checkups, correct? Like the doctor has to check you and make sure you're okay. Yeah, right? Yeah. Okay, so during that time, and you're talking with your doctor, and you're letting her know how, you know, they know what type of birth you had. They know, you know, that your baby's in the hospital. They know all these things. Did anyone ever talk to you and help you deal with the anxiety? And that's something I was saying. Like, who was dealing with your mental at that point?
Right. It was me and Jesus, because after a while my family couldn't understand it. And doctors, the first thing they want to do is label you as insane. They want to label you as crazy, like, oh, something is mentally wrong. I was just overwhelmed by life. I'm 21. I'm a new mom, so I kind of kept, only my family knew how severely I suffered from anxiety. So if it was a doctor's visit, I wasn't opening up to them about that. I was still learning what was going on with my body. So I was very quiet about the severe attacks I would have and things that was happening within my body. So I really didn't share that. But visits started happening to the emergency room.
You would think as a doctor, as your primary physician, I understand that you're going through something because of this situation. So I should, as I'm sitting here taking your information, I could be talking to you like, how do you feel about that? Because, I understand there's other trauma that comes with having a preemie.
Exactly. No emotional care. No. It was for them, it was like the norm. I don't want to say the norm, but it was like, oh, okay, you're just another preemie mom. But there is something that happens to you afterwards, because it's like you have so many questions. What did I do wrong? Why me? Why am I the first one in my family? Did I not do everything right? Like, it goes back to eating the right things and everything that we were talking about earlier, taking care of yourself. You beat yourself up because you're like, oh my God, my baby could have lost his life. What, is it me? Like, no emotional care afterwards. Nobody calling you. It was me, Jesus, and my family praying for me. Like, oh God, we just hope
the doctors. If I can give the doctors and healthcare professionals a defense, it don't make it right or wrong. It's just something for us to consider and for the people to think about. They deal with this every day, so it's normal to them.
Right.
They deal with this every day.
Exactly.
As consumers, if we don't tell the doctor what is wrong with you, if you don't tell a doctor what is wrong with you and your lab work does not indicate that there's a problem, then the doctors don't really know. When you tell them you fine, that's what they have to go on. I'm gonna tell you a situation, even though mine wasn't about pregnancy. I was going through chemo. You guys know I go to chemo. And I was going through my chemo session with my doctor. And I love, her name is Dr. Jacoby. I love Dr. Jacoby like a fat girl love cake. I want you to know I love Dr. Jacoby. So I was sitting in the office with Dr. Jacoby, and Dr. Jacoby was like, so Emma, what's going on with you? At the time I was still working. I was like, well, the people at my job getting on my nerves, blah, 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 blah. She was like, yeah, what else? I'm like, yeah, this is happening in my relationship, blah, blah, blah. She was like, what else? And I was like, yeah, this is going on with my family, this, that, and the other. Yeah, my kids getting on my nerves, my car breaking down, I ain't got no money, everything. Finally, after I got all of that out, Dr. Jacoby said to me, she said, listen, you have to let stress go, because your numbers, with all this chemo that we give you, your numbers are not changing. So if you don't let this stress go, your numbers, this chemo is either going to kill stress or cancer. It can't do both. And from that day to this, I don't let much bother me. Thank God for Jesus. I don't let much. At that point, I was like, God, whatever's bothering me, I put it in your hands. I'm not saying I don't never stress, but I don't stress for no long periods of time. I said all of that to say, we have to let our healthcare. Now, she recognized that because of my lab values. But in some cases, your lab values won't show that you're going through some issues. And we have to be women enough, and men, when you're going to the doctor, to tell your doctor, listen, this is what's bothering me. I don't want no crazy pills. I want you to tell me such and such and so and so, because ultimately you're responsible for your own health. You are responsible for your own health. And I could just say that only because, for a little while I was a nurse, and healthcare professionals don't really know what's going on with you if you don't tell them.
You're absolutely
don't tell them. So, and to all the people out here who are pregnant, who going through pregnancy, who scared, who got some issues going on, talk to your doctor. They get paid the same amount whether they see you for 5 minutes or 5 hours. You know what I'm saying? Yeah. They're not getting paid by the hour. So if something is going on with you, talk to your doctor. If you're not satisfied, there's a system that you can go through that say, listen, I'm not satisfied with this doctor. I'm not feeling secure with this doctor. Get you somebody that you're comfortable with, because then you feel open enough to tell your doctor, listen, in this pregnancy, my back hurt every morning at 2 o'clock. You understand what I'm saying? It might be you ain't drinking enough water. you know, whatever it is, you know what I'm saying? But the doctors don't know if you don't tell them. It's very important to be open and honest with the people that's taking care of you. Because I don't care what doctors think of me. I got that good health insurance. Thank God I was a state employee. You know what I'm saying? I got that good health insurance. And they send me for all these tests. Even when it's too many tests, I'm like, oh, y'all just sending me for these tests because I got that good health insurance. But if you have good health insurance or no health insurance, they're obligated to answer your questions.
Right.
They're
And
obligated.
see,
With that, Nye, as a young woman with no kids,
Yes.
how do you feel about this?
Wait a minute. Say no kids yet.
Yeah, no,
Not ever.
Yes,
Right.
yes.
yes.
No, in all reality, this was news to me. I just really started learning about this. I didn't even know this was a thing. I know I'm a Black female and I should have known, but I really was not aware until like you know, our governor's wife of New Jersey, she came to our church and she literally made us aware. She broke it down and everything like that. So I heard about it, but I wasn't really like exposed to it like I was this year. So like I feel as though it's sad. It's sad, especially because I'm a Black woman. You know, eventually I want to have kids and I don't want my race to get in the way of my healthcare. Us being in the United States, they say we have the best healthcare. So it shouldn't just be the best healthcare for white women, Asian women, Spanish women. It should be the best healthcare for all women, especially Black women.
Right. That's
for
right.
me to know that Black women, basically the rates are so high for us to either die from giving birth or to just not get the best health care. It's sad, but I'm really excited and happy that every year they make it aware so that we can try to fix the system, so that we can try to beat the norms or the statistics that we have right now. So I'm going to keep on or continue to do my research, and I am going to try to get doctors that actually care about me. So my question to y'all is, because I did bring up the race, do everyone have Black doctors? Or are you guys comfortable with not having a Black doctor? Because for me, to be honest, I had the same doctor for years. Well, after I had my little pediatrician, he's a great doctor. But recently I went to the doctor and I'm just like, you're really nice, but I just feel as though it could be more. You know what I'm saying? So I think I'm going to, you know, change providers to like a Black woman, just because I feel like she can relate to me.
It's interesting you said that. I had an Indian doctor at one point, and I did go through a tubal pregnancy when I was younger. I went through a tubal pregnancy, and well, that doctor did recognize that and the only reason why I went in, because a tubal pregnancy can lead to death.
Yes, it can.
I want everyone to know that. At this particular time, and I've never been pregnant a day in my life, but I was experiencing pregnancy symptoms, like the smelling stuff with, you know, I would get sick, and I would get like, God, I would just go through these things, and I was having pains, but in my back. So I'm sitting there like, yo, something's not right. And it's good to know your body.
Yes.
Something's not right. Like, let me just go in and make sure I'm okay, because something's just not, something is off. I went in just in the nick of time. He said, I have good news and bad news. I'm like, okay, well, what's the good news? You're pregnant. I said, okay. And then he was like, well, and then the bad news is that it's stuck in your tube. You have to leave from here and go straight to the hospital, because we have to do emergency surgery on you. And that's exactly what I did. Had I not, like I said, and I stayed in the hospital, I think over a week or so, I had the surgery. They had to remove the tube. And I was left with one tube at that point. But like I said, had I not had that surgery at that particular time, I would not be here. It's so good to know your body and know what your body is telling you, because your body talks to you.
Yes, it does.
Your body talks to you. So you just have to be aware of situations. Like anything can happen. God knows I didn't know I was pregnant. I wasn't missing anything, you know. I did not know I was pregnant at all, and that happened. Um, but nah, I want to ask you something. Being that you know you're in your 30s now, do you have concerns about because as we get older, we're less likely to have kids. Have you ever considered storing your eggs, or because no, most Black women don't think about stuff like,
Right.
storing your eggs and till later on, because at that particular time, you get old and you won't have kids. So we never even thought about tackling those issues. Have you ever thought about it?
Well, yeah. Before I turned 30, at the age 28, we were I was in a car with my family members, females, and it was like, "Girl, you better hit 30." I said, "I'm 28. I'm still great." No, I'm not old yet. But when I hit that 30 mark, I'm just like, it crossed my mind to freeze my egg, but right now, I think I'm good. But you know what? It really did cross my mind recently. That I'm going to consider, but I don't think I got to worry about that just yet. But I did consider it, to answer your question.
Yeah, you may want to try to maybe go and maybe see if your count, how your count is still, and just factor that in as well.
Do anybody know anybody who actually froze their eggs?
No,
I do.
I don't.
I did. This young lady at my job, she went in and she had found a donor, and because she wasn't, she's in the life or whatever, but she found a donor and she knew that she wanted a child, but all at the same time she wasn't doing nothing else to get that child. So this was her way of having her baby. So her baby is maybe, I think, 2 years old now. 2 years old now. So she went through the whole thing. It's expensive. Now, don't get me wrong.
I was gonna say that. I heard it's very expensive.
Yeah, it's like a hotel for your eggs.
Yeah, but you just have to have it in your mind that this is something that you want to do for you. Before you and probably save if that's the route that you want to go, because it's definitely expensive.
So just to ask y'all the question again, do everybody here have Black providers, or you guys don't really think it's a difference when it comes to your healthcare, like your PCP? Because I don't have one, but I'm considering
my
one.
primary is Black and my gynecologist is Black. Yeah, women, I might add.
My gynecologist is a Black woman. My oncologist is a Caucasian Jewish woman, and my primary care physician is a man.
Yeah, my primary care is a Black woman, but my gynecologist, actually, I had a Black woman gynecologist, and it was a good experience. But I have a lot. I had a lot of issues there, so I ended up having to go to another specialist. And he is actually a Caucasian male, which is, when I tell you, my right hand man, because I mean, last year was a thing for me. I had a surgery, and I mean, he, out of all of the gynecologists I've ever went to, he tops them. He does. I don't really foresee myself leaving, because he took me a mighty long way. Like the suffering and everything I endured that before my gynecology issues, he eradicated. So yeah, for that, he got me until he in his practice, and I got to go somewhere else. So
But you know what I find it's the quality of the doctor, not necessarily the race or the sex.
Right.
You know, if you find you a good doctor, if you find my primary care physician, he's about to retire and I have to find a new one. But he could look at you like he was awesome. I really like him. I haven't been to him in a while because I always go to my oncologist for everything now. But it depends on, I think I like to support Black doctors or Black businesses, period, But if I'm satisfied, I'm not going to switch just because you Black. You know what I'm saying? If I have to switch, then I'll consider your race and whatever, your gender. But like I wouldn't switch with my oncologist because I'm very pleased with her.
Yeah.
Well, my primary doctor is a Black male. However, my GYN doctors have always been other nationalities, more so Caucasians, but I've had like Queenz, a good experience, but unfortunately my doctor passed away. So since then I've been kind of like, going to different ones. And I think what Queen Emma said was most important, the one that I feel most comfortable with, and the one that seems to care and know their practice. Those are my main concerns.
Right.
How they treat me as a patient. I found with a lot of the women GYN doctors, sometimes, I said women, I didn't say colors, no colors, and it has nothing to do with that, but women could be a little bit less sensitive maybe, or a little bit more rough. So I've always had male GYN doctors, and I never had a problem with that at all. So it doesn't really matter to me. I have experience going to a doctor, I ain't gonna say no name, and I was very uncomfortable with him in terms of the way he did it. I'm not gonna tell you what type of doctor he was, but the way he did his business, the way he treated you as a patient, not really giving you all the detailed information. So someone had recommended him to me. I went to him one day and I never went back again. So, it just depends on the quality of that particular doctor.
Well, I can say my gynecologist I found her because I was having an issue, and the doctor that I had at that particular time, I don't know if everyone know, most Black women go through a whole thing of hysterectomy. I can't say I know why we do, but at this particular point, he was telling me that he wanted to give me a whole hysterectomy. I was like, no, I want to, and then I was able to still have kids. I was like, no, I want to still be able to have kids if that can still happen. Like, knowing that you're pulling everything up out of me, I know I'm not going to have a kid. So I found my gynecologist now, and she was like, no, we don't have to do that. All we have to do is do such and such. And she was able to save those parts of me where I was able to still, if I wanted to, consider having. But at that particular point, I lost my other two.
But that raises a question for me. How come one says I gotta do this, and then the other one was saying we have another alternative, we don't have to do that? So it's like, you really gotta look for somebody that's for your health, that's gonna help you get your best results.
Have a second opinion. You should always have a second
opinion. Exactly.
Try to rush into anything. If you know in your mind what you want to do, and you're not going to tolerate or just be like, okay, I'm going to give in to what he's saying. And I mean, at that particular time, I knew that that's not all God had for me. There's no way you're not going to tell me that this is what you have to do. This is your alternative, a quick alternative for you, but this is my life. At that particular time, I had to get a second opinion, and that's exactly what I did.
But see, now that's a good point though, Queenz. You said you had to get a second opinion. What about those that aren't knowledgeable, that they have the power to get a second opinion? Or those that don't feel that their insurance is going to be, or their lack thereof, to be able to get that second opinion and get that help. That's why the stats are so high in our community, because a lot of people, first of all, it's a lack of information. You suffer for your lack of knowledge, because a lot of people just don't know what they have access to. And that they have the power, like you said, Queen Emma, they're getting paid to be your doctor. They're getting paid to take care of you. They're getting paid, like Queen B said, to come back and give you the stats on why it happened and why I took your placenta and why I'm doing that research. Had that been another culture and they fought for that information, they probably would have came back and gave that information to that individual.
Mm-hmm.
So that's where, like Queen Emma, we got to hold them accountable too.
Exactly.
Right. Be able,
so
if I'm coming to you when you getting paid off of me, you're getting paid for these x-rays, you're getting paid for all of this, then I'm going to hold you accountable to give me the answers that you supposed to give me. But we gotta know that the power is in our hands. And a lot of times for the lack of knowledge, people don't push it in our culture to get and hold these people that they should accountable, the medical professionals.
That's true.
Yeah.
That is God's honest truth. I know 2 women that's at my job, they're family members. One young lady, sister, she went through a whole term, 7 months pregnant, and she had to be rushed to the hospital and she lost her baby. I don't know how, and the same happened to the other one. She went the whole term, 7 months, and she lost her baby. So I don't understand where that is happening. You go a whole like 7, 8 months and you're losing your child. So that's a big factor as well.
She was in the 3rd trimester.
Somebody in my family recently, well, she had the whole 9 months.
What?
The week before the baby was born, they went to the hospital because she felt like the baby wasn't moving. To this day, we don't know why the baby was not born. To this day, we don't know why she didn't have that child. So it's just like stuff like that really, it just really gets to me. 9 months she carried that baby.
And we also have to look at complications in pregnancies. Sometimes when you are pregnant or when you are when you're carrying, your baby or whatever, and you have family history of maternal complications, you become a high risk. Right. If you have high blood pressure, you are high risk. If you have, I can't remember the name of it, but it's this complication that you have where your uterus will like automatically open up before you start.
I've heard of that before too. I forgot about the medical.
And so there are times that you have to, like you said, know your body and be able to, let your healthcare provider know that you this runs in your family, so that you can be listed as high risk. Because when you're listed as high risk, they monitor you closer.
Yeah.
They monitor you closer. So, if you know that, high blood pressure running my family, I had a cousin that lost a baby. I had a sister that lost a baby. I've lost a baby before. Then, or you just feeling uncomfortable for whatever the reason, you can talk to your doctor if you have a good report and tell your doctor, I prefer to be considered high risk.
Right.
I prefer to be considered, and it's aggravating because you go to the doctor much more often. Yeah. But it's safer because they're closely monitoring you. They're monitoring you much closer.
And a lot of people can't be, what if you got to be on bed rest and you can't afford, afford to be on bed rest.
Yeah.
So we have a lot of women in our culture that literally I can't afford to be off my feet. I have to work because now when I have the baby, I'm not going to be able to work, immediately anyway. So I'm going to already be missing that income.
Behind.
Right. So how can I, in order for my baby to remain healthy, so I can survive these trimesters and have this baby, how can I be off my feet?
And you know what, Queen Taz, I was thinking of something very similar to that, being married. And we know in our culture, there's a lot of women that's not married and the husbands are the providers, because even if you don't have, like when you're married and he's working, you can get on his insurance. But since there are a lot of single women, they only have the system or their own, their own health insurance if they're working to rely on. So that's a whole nother factor. You're talking about an income.
Some of the jobs they have, there's no insurance.
Health insurance, right. Yeah.
Or it's crappy, like,
you got to pay a huge deductible and you ain't even got that, so I mean, I can definitely see how the stats are higher because you have other cultures or other situations where they can afford to be on bed rest. They have another income in the household, or, they literally have insurance that's good enough to, if they're on bed rest, they can do everything they have to do. They can bring in all those extra medicines or vitamins, or even bring help or a nurse in that can come check on you while you're home. Like, all of those different factors makes a huge difference.
So what are the solutions that we can give advice to someone that, or some young teenager or whomever that is pregnant and that need some type of advice as to what to do in order to get help?
Well, I would just want to share, knowledge is power.
Yes, it is.
Knowledge is power. Do not suffer for your lack of knowledge. So while we're talking about it, I was just I'm Googling some information just as far as giving, like, as even breastfeeding and things like that. Like, if you have a baby and a premature baby, how to do this, how to do all of that. Is hotline for support for for moms and young moms is 1-800-994-9662, and they help a lot with breastfeeding or just basic support. And then maternal and child health care concerns, 1-800-328-3838. So 1-800-328-3838. And that's all maternal health concerns. And they will get you the resources. They have access to resources all over the world, and they can connect you. But knowledge is power.
Yes, it is.
Don't sit in that place of, I don't know, so I don't do. Don't sit there. Ask questions, because you got to understand, it's not just your life, it's that life growing inside of you. Ask questions. If you don't feel like you have the help at home, or you're afraid to talk and speak up at home, get on them hotlines, Google, research, because they can help you, and it'll be strictly confidential and lead you in the direction where you got to go. But speak up. Do not be quiet about it. Speak up so you can get the help you need.
Another point that's important is that if you're feeling overwhelmed, they have those baby drop-off stations at most local hospitals, that if you have a baby and you just overwhelmed and you can't take it no more, as opposed to hurting your baby, drop the baby off. They ask no questions. They make no arrests. It's a free service. If you can't handle it, as opposed to having the baby suffer, take the baby to your local hospital. You can drop the baby off your local police department. You can drop the baby off and say, I can't take this. I can't handle it, as opposed to doing something bad and dangerous for the baby.
I never even heard of that. I didn't know that.
No? Yeah, you can take the baby. You can take the baby to a local emergency room. I know they have it at UMD&J, College Hospital, whatever they call it now. They have it down there. But you can take it to any local hospital or any local police department and let them know that I'm stressing. I can't. Say that again? Yeah, fire station. You can drop the baby off if you just feeling overwhelmed and you can't take it no more, and you don't have a family member or somebody that you feel, because sometimes you're going through postpartum depression. That's another major.
That's another big thing.
That's another topic. You're going through postpartum depression and you can't handle no baby right now. That baby crying, your whole brain is like overwhelmed, and you don't know what to do. Take the baby to somebody else. Absolutely. You don't have to suffer.
Absolutely.
And nobody looks down on you. It's not a bad situation. It's better that you save the baby. You're not a failure. Exactly. Yes. Exactly. So
I'm glad Queen Tan brought up knowledge is power, because not only do they have books, but they have everything on Google, but they have these apps too. Everybody love an app. Apps are fun. So they have all these resources. So that's a good thing.
It's a lot of resources.
Yeah, it's a lot of resources.
And I was going to add, if you feel uncomfortable with your doctor, go to another doctor. Yeah. Don't stay with somebody you don't feel comfortable with. And I had a question. So Lady B, before I ask the question, is there anything you want to add to the conversation?
Yes, I wanted to highlight someone. Her name, I know Queen Todd asked, what advice we would give. So the young lady, she doesn't know I'm going to do this. Her name is Kalina Berryman, and she is an advocate for preemie moms. and she does amazing things on social media. Her son was a preemie, and she throws all types of giveaways, gift cards. She's a part of meetings and all of that sort to give that emotional support that we were talking about earlier. So if you want to follow her preemie page on Instagram, it's Preemie Parents Club. Preemie Parents Club, Preemie, Parents with an S Club. Follow her for encouragement. And even if you're not a preemie mom, I'm sure she knows a lot of people and organizations or, groups that can assist in that area. So that's what I wanted to add.
Oh, that's beautiful. I just want to let y'all know that I know I'm 30, don't have kids just yet, but I'm not scared that I might not have kids in the future because we got women that's 50 years old having kids.
Yeah,
I don't want to bring up any
true.
but did Janet Jackson have that kid at 50?
That's true.
Yes, she did. Yes, she did. Her,
I don't got no fear.
Holly Berry had it. She got what, 2 now?
Yeah. So yeah, I don't have no fear in my heart. I brought that up to say I don't got no fear in my heart. I still got time, ladies.
Yeah, but those people who have babies at 50, they hire a nanny.
Yeah.
And they got that VIP insurance.
You want to have a baby at 50, you better be able to afford a nanny.
Right.
Trace, you had a question?
No, I'm going to skip my question because I know that our time is running down.
Well,
So
no,
we're
don't
gonna
skip your question.
Okay, so because this was going to take us into a whole nother conversation, but I just wanted to say I went into the Bible and I pulled out a scripture in Genesis chapter 1 verse 28, and this is and I'm paraphrasing what God is telling us to be fruitful and multiply. Now, one situation, and we talked about being honest with your doctor about your history, and that's something I want to talk about, abortions. A lot of times people have abortions and they don't want to tell their doctors that they had multiple or one or, a lot of abortions. So that's something that we need to, let our doctors know so that they know our history. Yeah. So and shame and, like it doesn't look like a blessing when you don't have the finances. Right. And I think that's a sad situation because children are always blessings, but it don't look that way when you don't have the money.
Right.
Or the resources or the support.
Absolutely.
That's good.
Absolutely.
Oh yeah, that's true, because when you at the doctor now, they don't just ask you if you have any kids, they ask you have any terminated kids or something like that, right?
Yes.
Whoa, wait a minute.
They ask you how many pregnancies or something.
Yeah, how many pregnancies you've had, even the ones that didn't go full term. How many pregnancies you have?
Because they count all of that. Wow, that's true.
Yeah.
Well, how do y'all feel about abortions? Women of faith.
Personally, I think that's between you and God.
For real,
I think that's between you and God. The Bible says, "Judge not that you be not judged." You never know a person's situation. I don't deal with the abortion question because to me, that's not for me to determine. If for some reason, I know people who have had abortions and I know people who are against abortions. And to me, if that's how you have to do your situation, God bless you. If you need a ride, call me.
It depends on the situation, because there are people that has been raped and had a child. What would you do in that situation? Would you bring the child to full term, and have to deal with that? So, I mean, it depends on the situation.
You are so right, Queen Ty, because sometimes people use abortion as a way of birth control.
Yeah,
that's why I have a problem with that. Yeah.
Right. Yeah. I was gonna add to that too, Queen T. I won't dive into whether I'm against it or not, but only thing I can say is be more careful, because I've heard of some stories where people just make it a habit. Yeah, and that part I think is not fair. So just try. None of us are perfect. We know that, but try to be more careful. That's all I can say. It's more than just taking a trip to that place. Right. Think about that before you make that decision.
Right. And as a Christian woman, we advocate abstinence. As a Christian woman, we say that you're not supposed to have premarital sex. However, the reality of it is, like I said before, that it's happening. So if that's your situation, just be careful, protect yourself, take care of your body, know exactly what it is that you're doing and know why you're doing it. You understand? You can't just have sex because it's Friday and your mother not home. You know what I'm saying?
Right,
You got 15 good minutes.
Yeah.
Right.
Make sure you go get checked out. Like,
Get checked out. That's very
know
important.
your body. Make sure you go get checked out, and make sure you're okay. Make sure you're okay on every level.
And this is not just for younger women. This is for older women too.
Older women
Right,
too.
that's right.
Yeah.
That's right. That's right.
Absolutely. And then
yeah, because there's a lot of situations where people could have went to the doctor just a little bit sooner to try to tackle on something. So like going to the doctor is important. And the older I get, the more I realize that.
Yeah, definitely. Because you don't see the significance in it when you're younger. Like, I know I didn't, as far as going to the doctor, because something kept going on, but it just kept forcing me to go. So I was just like, you know what, this must be important because this thing is wearing me out. But you don't realize it. Like, even my children, without having them be exposed to going when they're younger, they don't really see the importance of it. But you got a lot of young kids that just don't even go. So I mean, it really stems from your household and what you're exposed to and what you're used to, but pregnancies and abortions, like even abortions, it does harm to your body as well. So everything, it's just you just got to be cognizant of your body. Use wisdom in everything that you do. Queenz, did you have anything else you wanted to share before I proceeded?
Yes. If it's a financial issue for you, there's avenues that you can take. Just do your research and see where you can go that don't charge. Some places don't charge, or they charge little or nothing.
Yeah, on the sliding fee.
Right. So just please do your research, because it's very important to take care of yourself now, because it can be a long-term issue later on down the line you're not prepared for, and that you're not aware that had you not taken care of that back then, that you wouldn't be facing what you're facing now. So your body tells you what to do. It's important to listen.
Yeah.
I have one quick question. At y'all ages right now, would y'all have just one more child? Queen T, you can go first. You got that big mouth.
Right. Like what?
I would.
Who's gonna start?
I would.
Queen Ty said yes.
Emma, you oldest, you start.
You damn right. Ain't no way in hell. Honey, let me tell you something. I don't necessarily believe in abortions, but I'm telling you, if I got pregnant today or tomorrow, only me and God would know about it. You hear me? In the clinic. I'm telling you, no way on God's green earth would I be having a pregnant. I don't even know what I would do. I don't even like to babysit. You hear me? I'll hold your baby for a little while, and then you got to go back to your mother. Listen, I love my grands. When you start having grandkids, that means no more kids. You hear me? No, that's God's signal that enough is enough. No way on this side of glory will I be having other babies. I'm telling you, if I found out that I got pregnant, I want y'all to come visit me in the crazy ward, because that's right where I would be. Yeah. That's my position. That's my situation. Hey, girl, I'll be crying every day. I'll be like, what's wrong with Emma? She's so depressed. I was like, y'all not gonna believe it. Listen, but right now, if I had a baby, I would name that baby Jesus, because it would be immaculate conception. Okay, I'm sorry. Okay, y'all can cut that part out.
That's what Queen Emma.
Say it.
Are you kidding me, girl? I'm telling you. No. Like my grandson used to say, no, Nana. No way. No, sir. The thought of it just caused my blood pressure to rise, child. Are you kidding me? No, sir.
I'm going to add to that.
You just scared me.
Right.
Listen, I got my boys, 2 blessings, and my girl. I'm done. I'm done.
Yes,
I'm good. My children are grown. I don't want to start all over again.
You got the best of both worlds.
I got a boy and a girl. I can remember those days, but I'm done. Yeah. No,
I wanted a girl, and God gave me Terrell, so I was like, oh well.
Let me just say this. My circumstances right now does not allow me to have a child per the doctor. However, if it was to happen, I would not terminate. That's not an option. That's not an option for me. See, that's just a different opinion.
I was going all
that's
the
not an
newspapers.
option.
I would be on Good Morning America.
But but I that's not an option. But I
famous.
Yeah, even thinking about it.
I heard from Queen T.
And
how about you, Lady B? It's a yes or a no. You know, you still young, even though you love to say seasoned.
I used to want another one so bad. Of course, I would rather wait until after I'm married. I know the first time around what happened, but you live and you learn. But I don't know, because I babysat my great niece last night, and I was like, wait a minute, Jesus. No, but I go back and forth between trying to figure out if I want another one. I think more so now, like what Queen T was saying, Jay just turned 16, so it's like, yeah, he's real independent. I don't know if I want to start over, but my what I like to say is, if or when I do get married, and if my husband doesn't have any at all and he wants one, just one, I'll probably be like, all right.
You better buy him a doll.
Right? I mean, if it doesn't get too late, because I'm pushing, I'm climbing up the ladder now. So as long as it's not risky for me, then you know.
Ladies, this has been an awesome show. Yeah.
Yes.
Thank you, ladies. Queenzy, close out. So,
all right.
And thank y'all for being transparent. A lot of y'all were very transparent.
Yes.
And thank you, ladies, again for my birthday.
You enjoy your B-Day, Lady B. Enjoy.
Yes.
And we thank you. We thank all of you queens and kings out there joining in on this discussion, and making sure you know always knowledge is power. Knowledge is power. What you don't know, find out. With any means necessary, find out. Follow us on all of our social media platforms. Like, comment, and subscribe. If you have not yet subscribed to our YouTube platform, please do so. We appreciate your support. Any questions you have for us, email us at queenzquarters@gmail.com, or you can DM us. Either way, on all of our platforms. So once again, you have been a part of the Queen's Quarters experience, where there is a queen and a king in you. Next Wednesday. See you all.
Bye, guys.